Hi, it's Carl Lishing, independent insurance agent based out of Lakewood, Ohio. Today, we're going to do a little bit of a deep dive on individual health insurance plans that comply with the Patient Protection and Affordable Care Act, or ACA compliant health plans. Sometimes they're called marketplace health coverage. The street name would be Obamacare, but technically it's the Patient Protection and Affordable Care Act. So with these plans, they do have to cover pre-existing conditions. They are comprehensive major medical plans with things that people that have had group health insurance in the past, it covers the same types of things. It's a comprehensive major medical. Now, when the Affordable Care Act first came out, little history here, the insurance companies, they didn't know how to price a product that was guaranteed issued where they had to cover on pre-existing conditions. So they were kind of guessing on it. They priced it around maybe even a little bit lower than what commercial insurance for group health insurance plans were. And then claims started coming in and they realized that they were paying out a lot more in claims than compared to like group health plans. I guess looking back at it, it kind of makes sense. If it's a group health plan with people working, they got to be healthy enough to work. When you go to individual plans, you're getting more of a cross section of the American population. And there might be people that haven't had health insurance for a while because they couldn't get it. Now they have to cover it, and they got health conditions that cause higher claims. So first few years, the insurance companies that were operating within the marketplace were losing money. They were paying out more in claims than they were collecting in premiums. So they have to fix that situation. And the way they fix it is they have to increase premiums. And when they're increasing premiums, they don't want to do it any more than they have to. So they're trying to negotiate with healthcare providers to get them to come down on their reimbursement rates. Some of them are willing to do it if you're going to steer more business their way or more patients. Others aren't. So this thing kind of settled in over the next few years, and I'd say it has stabilized to some degree in the last 3 to 5 years, where they figured out how to price it. They got the carrier contracts that they wanted to. But there was some shifting in products, at least in Northeast Ohio. When these things first came out, there was large networks with PPO networks that were big. When they're negotiating those contracts, trying to get carriers to come down on pricing, some of these contracts or ACA compliant health plans have narrower networks these days. So it's harder to find a plan that has a big PPO network locally, and then even harder to find one that's a real national network, like on some group health plans. But the pricing has kind of stabilized. Now, when choosing an ACA compliant health plan, it's largely driven by the network. So if there's certain doctors and hospitals that are important for a person to have on a plan, we need to verify that first. And then their medications are going to be another big component. A lot of medications are inexpensive, but some of them are not. And some of the higher cost drugs that are $500 plus a month can have an impact as to what plan they should enroll in. So it's really driven by prescriptions, provider network. And then with ACA compliant health plans, they got 3 different levels: bronze, silver, gold in our market. Bronze level plans, they tend to have higher deductibles, a little bit higher maximum out of pockets. Silver level plans, a little bit lower on the deductibles, maybe a little bit lower on maximum out of pockets, but usually not, because they all have a high limit on what that maximum out of pocket can be year after year. And a lot of the plans will push that, the limit on that maximum out of pocket that is allowed. Then there's gold level plans. So at the bronze level, they have to be actuarially equivalent to cover 60% of the claims costs with an out-of-pocket limit no more than a certain amount. And that number will change year after year. Silver level plans, 70% actuarially equivalent with an out-of-pocket limit no more than a certain amount. And then gold level, 80% actuarially equivalent. So it's really about the stuff under the maximum out of pocket and how that's covered, because the high-end limit is the same on a lot of, like a bronze plan can have the same maximum out of pocket as a silver or a gold plan. So sometimes I think it becomes questionable if it makes sense to pay the extra money for the silver or the gold if the high-end maximum out of pocket is still going to be the same. A lot of times to go from bronze to silver, it could be based on prescription drug cost, because at the bronze level plans, a lot of the more expensive drugs are always subject to the base plan deductible. Where at the silver level, you might find something that's $500 a month where they can get it for a flat copay, would say that was $45. So yeah, the premium might be a couple $100 a month more, but it might be worth it because of that prescription drug situation. So the right fit for an ACA compliant plan really depends on the individual, their health, their lifestyle, their income, and if they're getting federal tax credits or subsidies to help them buy it. It is going to be case by case. It's far from a one size fits all world. So this one works best by having a conversation. If you'd like to talk more about it, call us or use the scheduling link to book an appointment. Thanks for your time and have a good day.